So this is a loading technique to the back part of the hip or the butt area, roughly covering right where the belt would be, down in through the gluteal fold or the area right where it creases. So you're going to cover this area right in through here. You're going to need a ball. You're going to place the ball against the wall. I'm going to sandwich that ball with my tush and also the wall just like that. My feet are going to be out about 1.5 to a foot away from the wall. And then from this position, I'm just going to lean into the ball that's on the wall. So I'm going to do one of two things. Number one is I can do a seek and destroy. So I'm scanning that area, trying to find an area that's sensitive. Once I find an area that's sensitive, I'm going to hold that there. And then to destroy it, what I'm going to do is take a breath in and exhale. And when I exhale, I'm going to apply a little bit more pressure into the ball by leaning my body into the ball. So I'm going to take a breath in, exhale, and then just try to melt into the ball. Once that tissue melts, then you're going to find another spot, do the exact same thing. The second technique you can use is more of the pin and stretch. So I'm going to do the exact same thing. I'm going to find an area that's sensitive, and once I do, I'm going to pin it down by applying more pressure into it with my body weight. From there, I'm going to hold that position, and then I'm going to bend at my hip. So I'm going to do a hip hinge. As I start to hinge backwards, my body's actually going to stretch out and hold that until it desensitizes, and then I'm going to find another area. What I can do from this position as well is not only lean forward until I feel an additional load, but I can also twist my torso. So I'm going to turn this direction, or I can turn the opposite way. I actually feel more when I turn towards the same side that I'm working on, and I'm just going to hold that load. And then I'm going to relax right after it desensitizes, reverse the steps, and come out of it. So another variation you can do with the pin and stretch is you can pin that tissue down, hold it there, and then you're going to bend the opposite knee up towards your chest. So when you do that, you might have to bring the opposite leg closer towards midline so it's easier to balance. So I'm going to bring my foot towards midline. I'm tacking the tissue down and pinning it down. Then I'm going to bend the opposite leg so I can stretch out that tissue. I'm going to grab it with the same side arm and try to slowly bring that knee up towards my chest just a bit while I'm still pinning down that ball. And then slowly lower back down. Do that exact same thing. Find another area that's sensitive, pin it down by applying more pressure, bending my knee up towards my chest, holding it with my other arm so my hip doesn't have to do most of the work, and try to hold that position until it melts and desensitizes.